The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Melissa. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Please be seated. May I ask why you have come to see me?
Well, I have had a sudden onset of pain by lifting a weight of about 40 pounds at my workplace. I have developed pain on my left hip. Although the pain is dull, it is aching and stabbing. The severity ranges from mild to severe. The pain is present constantly and worsens while sitting, twisting, lifting, or riding in a car. The pain improves after resting. Sleep alteration due to pain is positive, and I wake up after getting to sleep. I'm feeling depressed all the time due to this persistent pain and have lost my interest in all activities. I get insomnia, lack of concentration, fatigue, and loss of energy.
Do you have pain on your spine?
Yes, doctor.
Your age?
48, doctor.
Are you attending your work?
No, doctor. I am not going to work.
Have you been immunized before?
Yes, doctor. I had flu vaccine 2 years ago and pneumonia vaccine 5 years ago.
Do any of your family members have a history of illness?
My father is 79 and had a cerebrovascular stroke and hypertension. My mother had a congestive history of heart failure and died at the age of 70.
Tell me if you have any past medical history.
I had an appendectomy 7 years ago and a cholecystectomy 3 years ago.
Do you drink or smoke?
I used to smoke before, but I have stopped smoking nowadays, and I drink socially.
What medications are you taking now?
I am taking Lortab 10 milligrams whenever I get pain.
Are you allergic to any medication?
No, doctor.
Well, your MRI shows small central herniated nucleus pulposus at L4/5, bulge at L3/4. There is a shallow left parasag, herniated nucleus pulposus at L5/S1. There is an entrapment of the superior gluteal nerve in the aponeurosis of the gluteus medius left, and you are also suffering with depression and sleep disorder. So I would recommend you take a treatment for superior gluteal nerve block left. I am going to prescribe you baclofen 10 milligrams before bedtime, flurbiprofen 100 milligrams twice a day, hydrochlorothiazide 25 milligrams once in a day, and Klonopin 0.5 milligrams before bedtime. Continue these medications for 3 weeks and meet me thereafter for a scheduled follow-up for medical management and reevaluation of your condition. Depending on your condition after 3 weeks, I will decide if any diagnostic or therapeutic intervention is required or not.
Okay, thank you, doctor.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Rasputin. For questions 13 through 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Extract 2. Good morning. Please take a seat. Tell me about your problem. Good morning, doctor. I currently work as a phlebotomist and respiratory therapist in a hospital. When I was attempting to do a blood gas, I had my left hand finger over the pulse and I was inserting the contaminated needle using my right hand. I was wearing protective clothing and gloves. As I advanced the contaminated needle, I jerked away, causing me to pull out of the arm and accidentally pricked of my index finger. I was seen and evaluated at the emergency ward immediately. In the diagnosis, I was found to be a carrier for hepatitis C and negative for HIV. I had a periodic screening, including blood tests. I completed a 3-shot series for hepatitis B and had titers drawn that shows protected antibodies. I am up to date on my immunization, including tetanus. What's your age? 36, doctor. What medications are you taking? Nexium. Any previous medical history or surgeries? I had degenerative disc disease in my back. Are you allergic to any medications? I am allergic to IV contrast. Are you continuing your work? Yes, doctor. Well, your temperature is 97.2 degrees, pulse rate is 84, respiration's 14 and unlabored, and blood pressure 102/70. You are negative for HIV. You have no other symptoms suggesting acute hepatitis. Your liver function test is normal at 18 and you have no signs of infection. You have developed acute intestinal illness due to blood-borne pathogen exposure secondary to contaminated needle stick. Continue with Nexium 20 milligrams a day until the condition improves. Otherwise, you are medically fit and no need for further diagnosis or treatment. Thank you, doctor.
That is the end of Part A. Now, look at Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about different complications following heart attack.
Hello, doctor. What types of complications are expected following heart attack?
Well, there are 2 types of complications that can occur following a heart attack. The first problem occurs pretty much straight away, and the second complication occurs later on. Immediate complications following a heart attack are arrhythmias is the immediate complications in which the heart beats irregularly, either too fast or too slowly. Cardiogenic shock is when the patient's blood pressure drops suddenly. Therefore, the heart cannot supply adequate blood for the body to function properly. Hypoxemia is the condition when the oxygen levels in the blood become too low. Pulmonary edema occurs when the fluid accumulates in and around the lungs. Deep vein thrombosis occurs when the deep veins of the legs and pelvis develop blood clots that either block or interrupt the flow of blood in the vein. Myocardial rupture occurs when the heart attack damages the wall of the heart. That has an increased risk of a heart wall rupture. Ventricular aneurysm is when a heart chamber called a ventricle forms a bulge. Question 26. You hear the discussion between 2 doctors about the impacts of acute kidney injury.
What are the impacts of acute kidney injury, doctor?
Acute kidney injury is a common and severe complication of surgery, especially cardiac surgery. Often, the complication is associated with higher rates of morbidity, mortality, and cardiovascular events, longer hospital length of stay, and higher cost. During stage 1, there will be an increase in serum creatinine of 1.5 to 1.9 times baseline, an absolute increase of at least 0.3 milligrams per deciliter, or urine output of less than 0.5 milliliters per kilogram per hour for 6 to 12 hours. During stage 2 of acute kidney injury, there will be an increase in serum creatinine of 2.0 to 2.9 times baseline, or urine output less than 0.5 milliliters per kilogram per hour for 12 or more hours. During stage 3 of the condition, there will be an increase in serum creatinine of 3 times baseline, an absolute increase of at least 4 milligrams per deciliter, initiation of renal replacement therapy, urine output less than 0.3 milliliters per kilogram per hour for 24 hours or more, or anuria for 12 or more hours. Question 27. You hear a discussion between two doctors about acquired melanocytic nevi.
Hello, doctor. What are acquired melanocytic nevi?
Acquired melanocytic nevi are clumps of melanocytes that originate during childhood but manifest during 30 to 40 years of age. Junctional nevi form macules, with the skin markings becoming slightly more prominent. They are circular flat lesions with a uniform brown coloration. They have lentiginous cells, which are round or oval or spindle-shaped. Dermal nevi are raised pale brown or skin-colored lesions, and often hairy, having focal globules and fine vessels or pale areas. Pseudohorn cysts may be seen. The cells are epithelioid with amphiphilic cytoplasm, and the melanin is in granules. Compound nevi may be raised with a wart-like surface in certain cases, and are usually lighter brown than junctional nevi are. They have round or oval globules of pigment, and these may form cobblestone patterns. Question 28. You hear a discussion between a doctor and nurse about amblyopia.
Hello, doctor. Can you explain what is an amblyopia?
Well, amblyopia is the medical term for lazy eye that refers to a condition in children where the vision in one eye fails to develop adequately. This usually affects ability of the child to see using the weaker eye. In strabismic amblyopia, a squint develops due to a mismatch between the muscles that support the position of the eyes. Therefore, the brain ignores the eye that is not straight and relies on the images generated by the stronger eye. In a condition called anisometropic amblyopia, the refractive error is greater in one eye than the other eye. Therefore, the brain ignores the more farsighted eye and relies instead on the eye that provides a clearer picture. However, the weaker eye remains straight. Therefore, the defect may go unnoticed by the parents or primary care doctor. In the condition called deprivation or occlusion amblyopia, one eye is deprived of vision due to the development of a blockage, such as a cataract. The ocular media becomes opaque, preventing visual information from reaching the brain. Question 29. You hear a discussion about miliaria.
Hello, doctor. What is miliaria?
Well, miliaria is the conditions associated with sweat retention in the skin. When the flow of sweat is obstructed, the sweat stays trapped within the skin instead of moving out from the sweat glands to the surface of the skin, developing various symptoms and signs, including skin lesions. Miliaria crystallina, also called pseudomina, describes sweat duct obstruction in the uppermost epidermis, where the sweat is retained to form subcorneal vesicles. These clear, non-inflamed, fluid-filled blisters and papules rupture easily, and even light rubbing can cause them to break. Miliaria rubra, also called prickly heat, and refers to the retention of sweat that moves into the middle layers of the epidermis and the upper dermis, resulting in itching and redness around the sweat pores. Miliaria pustulosa occurs when the miliaria rubra develops as inflamed pustules. Miliaria profunda occurs when the sweat moves from the ducts into the dermis. Hard, flesh-colored, painful papules develop that are much larger and more deeply located than the papules seen in miliaria rubra. Question 30. You hear a lecture about different type of stents. We see today what is stent and what are the different types of stents. Stent is a splint that is placed inside a duct, blood vessel, or canal temporarily to aid healing or relieve an obstruction. Primarily, they are used to keep narrowed blood vessels open and patent, to allow sufficient blood flow or bodily fluid. Coronary stents are a tubular, mesh-like device that do not have any embedded medications in them. Drug-eluting stents are coated with medications to prevent inflammation and retinosis of the artery on a long-term basis. A urinary stent is used to hold open the ureter in cases where it is narrowed. Ureters are long tubes that carry urine from the kidneys to the bladder, where it is stored until it is emptied. Urethral and prostatic stent is used to open up the narrowing caused by an enlarged prostate pushing against the urethra, preventing the normal outflow of urine. Peripheral vascular stents are used to keep blood vessels outside the coronary arteries open. Stent grafts are tubular devices made up of a special fabric that is supported by a rigid metal stent. These are mainly used for vascular surgeries, such as to repair abdominal aortic aneurysm. Stents can also be used to keep the food pipe of the esophagus open in case of esophageal constriction, and biliary stents can be used to maintain adequate drainage of bile into the intestine.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you will hear two different extracts. In each extract, you will hear health professionals talking about specific aspects of their work. From 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at the Extract 1. Extract 1, questions from 31 to 36. You hear the doctor briefing his juniors about different types of chest pain in female patients. You have 90 seconds to read the questions from 31 to 36. Chest pain is one of the common health issues from the patients in medical OPDS that causes a lot of anxiety in the patient, as it is often connected with a heart attack or angina, and people are well aware of the severe consequences of the symptom. However, a chest pain is not necessarily caused by or originating from the heart diseases. There are numerous other structures in the thoracic cavity. Therefore, a systematic approach is crucial to arrive at the correct diagnosis causing the chest pain. A chest pain in menstruating females has a great significance, as they are less liable to get heart diseases until menopause. Estrogen prevents the development of atherosclerosis. Coronary artery disease or myocardial infarction is very rare in menstruating females. As menopause approaches and estrogen levels decrease, the chances of development of coronary artery disease increases. Reversible loss of blood supply to the heart muscle called angina pectoris or cardiac pain is retrosternal, poorly localized, vague, heavy, squeezy feeling, compressive. Angina pectoris rarely lasts for less than 1 minute or more than 20 minutes. Unless it is a heart attack, patients are relieved in less than 5 minutes on the use of sublingual nitrates or cessation of all activities. Angina pain can also occur in the left arm, left shoulder, the jaws, or neck. Sudden blockage of an artery supplying blood to the heart muscle called myocardial infarction would be similar to this but very severe and lasts longer. The pain will not be relieved by sublingual nitrate or rest, and the symptoms are palpitations, nausea, vomiting, perspiration, blackout, dizziness, or even mortality. Pain that is unlikely to be of cardiac origin is often well localized, lancinating, prickly, sharp type lasting for less than 15 seconds at times. It can also be an aching type but mostly will be aggravated by coughing and deep inspiration. Often, the patient will be able to localize the pain with the tip of the finger. However, the pain that is localized just below the left nipple will never be from cardiac origin. Common causes of chest pain in young females. Mitral prolapse is a common and benign condition. Leaflets of the mitral valve are lengthy, redundant, and bulky. They prolapse into the left atrium during systole. The causes of this pain are unknown. The pain occurs at rest, non-radiating, prolonged in duration, and sharp. Mitral stenosis or rheumatic valve disease is a common rheumatic condition in females and can cause dyspnea and chest pain. The patient will have symptoms like expectoration, a cough, and there would be low-pitched rumbling diastolic murmur that will clinch the diagnosis. A 2D echocardiography will be confirmatory. Now look at Extract 2, questions from 37 to 42. You hear a doctor briefing his juniors about blood transfusion. You have 90 seconds to read questions from 37 to 42. Extracting blood or blood components products from one individual and inserting them into the circulatory system of another individual is known as blood transfusion. Therefore, the blood transfusion can also be considered a form of organ transplant. Generally, it is performed as a treatment for different medical conditions, such as massive blood loss due to surgery, trauma, shock, and other conditions in which the body tissues are not oxygenated adequately, where carbon dioxide or other toxic materials are not effectively removed, and where the red cell producing mechanism fails. Great care should be exercised during a blood transfusion to make sure that the recipient's immune system is compatible with the transfused blood, and also that the donor's immune system is compatible with the recipient's immune system. Moreover, blood type classifications A, B, AB, and O, and the rhesus factor classification, positive or negative, should be verified. Nowadays, a number of tissue type factors are also considered to determine histocompatibility. These tissue type factors become increasingly crucial in patients who receive many blood transfusions, as their bodies have to develop increasing resistance to the transfused blood. Depending on the needs of the community, at the time only parts of the blood are taken for transfusion. Blood is composed of red blood cells, platelets, and plasma. The platelets and plasma can be donated separately in a process called apheresis. In this process, blood is separated into components after being extracted from the donor. For instance, albumin protein is transfused for treating burns, and platelets used for treating hemophilia, cryoprecipitate, and immunoglobulin antibodies are transfused for treating immunological disorders. There will not be transfusion-related risk factors for the blood donor while transfusing the whole blood, besides the minute chance of infection or injury to the site. However, this is a certain risk to the donor when he donates plasma and has red blood cells reinfused. However, this risk is preventable by following appropriate sterilization procedures. Significantly, it has caused severe public health hazards in China, where they were often unregulated. The plasma collection centers of the U.S. are the best-known examples of safe apheresis donation, which is maintained by pharmaceutical companies, involving paid donors up to twice a week. Interestingly, veterinarians occasionally perform blood transfusions to animals. Different species require different levels of testing to ensure a compatible match. Cattle have 11 blood types. Cats have 3 blood types. Dogs have 12 types of blood. Pigs have 16 types, and horses have 34 types of blood. The experimental and very rare practice of interspecies blood transfusions is known as a form of xenograft. That is the end of Part C. You now have 2 minutes to check your answers.